Okay, so we've got a bit more of an interesting one here. So this is what we call an interdigital corn. So it just means between the toes, obviously. Now, the reason these grow is usually because the fatty pads wear out between the toes and the bony lumps. So if we have a look at the anatomy of those toes, there's two little joints in the little toe there, and on the sides of them, they've got these little bony lumps that sort of flare out to the sides. So they push together with the adjacent toe and they cause this hardened skin. So when the hardened skin thickens, it causes more hard skin, and eventually it causes this painful little hardened section called a corn in between the toes. Now these are really, really painful. You can imagine if you had a little piece of stone or rock in between your toes and pushing, and then you try and jam that into a shoe that squeezes your toes together. If it's in the same spot over and over and over, you get the corn form, and then you can actually see the tissue fluid's been pushed out of here, and that's why we're getting that white little section, like a little halo around it, and we're also getting this tiny little ulcer forming on there. So these are really, really painful. They're not particularly painful to remove. So this is a hard interdigital corn. You can also get a soft interdigital corn, but they're a lot whiter, and they need to be just basically remove dead tissue. But this is hardened dead tissue that we're removing here. So obviously we go in there with the tip and try and remove as much of the dead tissue as we can, and then smooth the edges down so they're not undermined or ulcerated, or so it'll give it the best chance of healing. So there's a few options for treatment long term with this one. Sometimes we make a little prop that goes in between the toes, like a little silicone custom made prop that separates the toes, and we cut a hole in it so it doesn't irritate this section. We also obviously go with wider shoes, and there's also a number of surgeries you can do to trim the bone out of the toe, or we can actually stitch the toes together to treat this permanently. But this patient doesn't want to do that. They just want to have this treated a couple of times a year. They'll wear their little prop as it gets sore or if they get caught out, and they're happy to switch their shoes. Now, always, surgery is the last resort that we go to here once they get frustrated or annoyed with getting this done. If that happens ever, we can always send them off for surgery. And that's a permanent solution to this. It's really quite a simple surgery as well. That we do it in the chair, and it just really does fix the problem quite reliably. But if they don't want to get that done, we're happy to treat this one just conservatively with a toe prop and trimming it out. So you see we're basically going in there now and just trying to smooth those edges down so it's got a less likely chance of growing back. And then we'll see how the wider shoes go, something maybe in a 2E or 4E fitting, and just obviously avoid slip-on shoes that will actually squish that together. But you can see that little ulceration there. We've removed it all now, and we'll review this one in 5 weeks.